With folate and folic acid, the better opening is to rank the claims. People hear pregnancy, neural tube, homocysteine, anemia, and mood claims, but one useful claim should lead. Plausible claims should stay smaller, and vague wellness language should come last.
The strongest benefit gets the largest frame. Preventing neural tube defects with folic acid before and during early pregnancy is the strongest, most actionable benefit. Then we ask whether the pathway and the person actually match. The useful answer is benefit first. Folate is a B vitamin essential for DNA synthesis and cell division, and folic acid before and during early pregnancy has strong evidence for reducing neural tube defects. Broader mood and heart disease claims are weaker than that pregnancy case. We will explain what the body's doing, which benefits are most plausible, and then where the boundary sits. The first benefit to understand is this. Preventing neural tube defects with folic acid before and during early pregnancy is the strongest, most actionable benefit. That matters because folate is required for DNA synthesis, methylation, and healthy red blood cell formation. This connects folate and folic acid to a real body pathway, not just a marketing word. First, follow the substance after it enters the body. Folate is required for DNA synthesis, methylation, and healthy red blood cell formation. This is the first reason the supplement is more than a label on a bottle. Then ask what changes downstream. Adequate folic acid around conception supports proper neural tube closure in the earliest weeks of pregnancy. This is where the benefit becomes something you can measure, feel, or track. The second benefit to understand is this. Correcting folate deficiency anemia is well established. That matters because adequate folic acid around conception supports proper neural tube closure in the earliest weeks of pregnancy. This connects folate and folic acid to a real body pathway, not just a marketing word. The third benefit to understand is this. Homocysteine can fall with folate, though that alone does not prove cardiovascular or cognitive benefit. That matters because folate and vitamin B12 operate in the same one-carbon pathway, which is why the two must be interpreted together. This connects folate and folic acid to a real body pathway, not just a marketing word. Context is the switch that changes the answer. Folate and vitamin B12 operate in the same one-carbon pathway, which is why the two must be interpreted together. The same supplement can be helpful, irrelevant, or too strong depending on that context.
So the question is not whether folate and folic acid is exciting. The question is, who is the person most likely to benefit, and what would tell them it is working?
The best fit user for folate and folic acid is not everybody. It is the person whose goal, symptom, marker, or routine lines up with this pathway. Preventing neural tube defects with folic acid before and during early pregnancy is the strongest, most actionable benefit. In that context, folate and vitamin B12 operate in the same one-carbon pathway, which is why the two must be interpreted together. Then the form matters. A food source, a standard capsule, a concentrated extract, and a study product can behave differently. So folate and folic acid should be judged by the exposure that actually reaches the target pathway. Adequate folic acid around conception supports proper neural tube closure in the earliest weeks of pregnancy.
Now, give me the boundary in proportion. We are not trying to scare people away from folate and folic acid. We are trying to keep the useful benefit from being used in the wrong context.
The main safety boundary is specific. High folic acid can mask a vitamin B12 deficiency and delay diagnosis of nerve damage, so B12 status matters. Also remember this second boundary. People on methotrexate, some anti-seizure medicines, or with a cancer history need clinician direction before high-dose folic acid. That is a reason to personalize, not a reason to turn the whole lesson negative. The simple tracking plan is positive and practical. Choose one target benefit, decide what would improve, watch for the main boundary, and stop if supplements do not replace evaluation of unexplained anemia or neurological symptoms. The practical ladder for folate and folic acid is benefit first. Name the benefit, understand the pathway, match the person, choose the right form, track the outcome, and keep the boundary visible.
So the fair summary is not negative. Folate and folic acid may be useful when the target is specific, the pathway makes sense, and the person can actually track the benefit.
Exactly. The body ladder rule for folate and folic acid is simple. Explain the benefit deeply, respect the boundary, and make the decision useful.